Hello everyone, can you guys hear me? Hello? Okay, I'm finally getting some messages. Good morning. Good morning, where you're at. Hello everyone. Good morning. Oh, good morning. All right, guys, it's Friday. It's another day. Today's going to be really information heavy, so there's a lot of information to cover. This is a really important chapter. We're going to be going over chapter 31, which is cleaning, disinfection, and sterilization. Cleaning, disinfection, and sterilization is a really important chapter. Now, I know I say this about a lot of chapters. I know that I tell you there's a lot of really important information, but that is because there is. The CIC requires a tremendous amount of study. Now, I do think that you would be more than able to prepare within a 6-week time frame, but it has to be 6 weeks. I'm having trouble hearing you. It sounds like you're in a tunnel. Okay. Do I sound like I'm in a tunnel for anybody else? I sound like I'm in a tunnel. What? That's not cute. Okay, give me 1 second. Is this any better? Not really.
Okay. So there's an echo. Okay, I fixed it. Everybody can hear me? Okay, hey, and I didn't have to call IT, I didn't have to call for backup. Figured it out. Okay, so we have a win already. Okay, perfect. So, I know you guys see me on the struggle bus every time with technology, so I appreciate the patience. But back to chapter 31, now that I am live and in stereo, this one is an important one. It's a long chapter, there's a lot of information, and I really recommend that you read through it multiple times. Same thing with chapter 13. There's just going to be a couple of really key chapters where the information is going to continuously come up throughout the test, and this is one of them. Another thing is, if you don't work in healthcare, so specifically if you are one of my healthcare epidemiologists or just an epi, this section might also be a little bit more difficult for you because it's harder for you to get hands-on experience with an SPD department. Okay. So cleaning, disinfection, and sterilization, basic definitions. So we have 3 primary categories that medical devices fall under, depending on what type of tissue or that item is going to come into contact with. So items that contact sterile tissue, such as surgical instruments, would fall under what category? Critical. Thank you. Next one, items that contact mucous membranes, such as endoscopes. Semicritical. Great. And then the very last one is devices that contact only intact skin, such as stethoscopes. Non-critical. Perfect. So the blank divides medical equipment into 3 categories based on risk and continues to be the primary principle that guides disinfection and sterilization processes. What is that called? Spalding classification system. Great. Do you guys know what Spalding's first name was? Everybody knows Spalding classification. San Joseph Earl. I know. Yes, his name was Earl. I don't know why, but I just wasn't expecting it when I when I looked it up. I was like, it's Earl. Okay. Just it didn't seem to match, but yes, Earl Spalding. So that's where we get the Spalding classification from. And it's pretty fantastic. We're still using it to this day, which is exciting. Environmental decontamination plays an important role in decreasing bioburden, which may help lower rates of healthcare-associated infections. Environmental surfaces include non-critical items as designated by the Spalding classification system, as well as high-touch surfaces, such as countertops, bed rails, and tray tables. All right, this chart right here. You need to know these definitions. These definitions are the definitions that are going to be on the test. So whenever you read them, you need to be able to link them back to their specific, to that specific word. So for sterilization, it destroys all microorganisms, including bacterial spores. Here you have the method, examples with processing time, and your healthcare application. Now, all of this is important, but most important by far is these definitions right here. You have to know them. There's no way around it. You have to know it. High-level disinfection destroys all microorganisms except high numbers of bacterial spores. Intermediate level disinfection destroys vegetative bacteria, mycobacteria, most viruses, most fungi, and but not bacterial spores. And then your low level disinfection destroys vegetative bacteria, some fungi and viruses, but not mycobacteria or spores. So now that we went over that, first one, destroys all microorganisms except high numbers of bacterial spores. What is that? Now, in this specific example, in this slide, you can see all of the different classifications, right? And you know that sterilization, high-level disinfection, intermediate level, and low level are going to match with one of them. When you're taking the test, you're not going to have that. So you need to make sure that you're able to pick out which one it is. Okay, so I'm getting a ton of high-level disinfection, which is correct. Good job, 5 stars. All right, next one. Next one. Destroys all microorganisms, including bacterial spores. We're on this one. It destroys all microorganisms, including bacterial spores. Sterilization is correct. Getting a lot of sterilization, good. Next one, destroys vegetative bacteria, some fungi and viruses, but not mycobacteria or spores. You have 2 options left. So it's either intermediate or low level. And I'm getting a lot of intermediate. However, that is incorrect. It's going to be low-level disinfection. Low-level disinfection destroys vegetative bacteria, some fungi and viruses, but not mycobacteria or spores. And then the last one destroys vegetative bacteria, mycobacteria, most viruses, most fungi, but not bacterial spores. That's going to be intermediate level disinfection. So you have to know your definitions. All right, so this presentation focuses a lot of information and there is a lot of reading from the slides. For those of you who are auditory learners, this is going to be really helpful. For those of you who are visual, hopefully helpful, but for people who are really appreciate our lessons where there's a lot of questions, that's definitely not this type of PowerPoint because we have a lot of basic information that we need to cover. All right, so cleaning. The cleaning process for critical and semi-critical devices should begin as soon as possible after use. Gross debris should be removed by wiping or irrigation as indicated by the instrument manufacturer's instructions for use, the IFUs. Removal of gross contamination prevents the drying of blood and tissue, reduces the bioburden and nutrient material on medical instruments, and reduces the possibility of spillage or aerosolizing of contaminants into the environment. Now, this is extremely important. Currently at our facility, one thing that one of our infection preventionists, Charles, is working on is on getting that point of use cleaning in the ORs to happen consistently. Now, ideally, you're going to have techs who do a really good job at ensuring that things are staying clean throughout a procedure, but we do have a lack of standardization and there needs to be some improvements. So one thing that I recommend that you do if you're an IP and you have a facility is to go spend some time in your sterile processing department. So one of the things that Charles is currently doing is with our OR educator, they go stand together in sterile processing decontam in their decontamination department. And when people are dropping off their trays, they're literally having them open their trays and they're taking a look to see the condition that their trays are in. Because we have this misconception in healthcare sometimes where, oh, no, that's EVS takes care of that. SPD takes care of that. Nursing takes care of that, where you get siloed and you get separated and you can't really see the bigger picture. And that's one of the responsibilities that infection prevention has, where we have to bring people together and we have to bring departments together and we have to help them understand that this is bigger than you. Right? This is bigger than you. This is bigger than departments. This is about patient safety, staff safety, all of the above. So point of use cleaning, and cleaning is the absolutely most important thing when it comes to cleaning, disinfection, and sterilization. You cannot disinfect an item if it's not clean. You cannot sterilize an item if it has not been properly cleaned. Now, you need to spend time in your SPD department. It's really important. I'll dive into why it's so important for you to set time aside. If not on a weekly basis, then at least at once, twice a month, because you need to know what's going on in that department. If soiled materials become dried or baked onto the instruments, the removal process becomes more difficult and the disinfection or sterilization process becomes less effective or ineffective. Instruments should be kept moist after the initial removal of gross contamination and prior to transport for additional cleaning, disinfection, and sterilization. Another reason why it's really important to spend time in SPD in your ORs is because you're going to have procedures that vary in length. And depending on the length of a procedure, you could be in an operating room for 4 hours, for 5 hours, for 6 hours, for 7 hours. And if you have staff who are not doing a good job of keeping those instruments moist, it's going to be an issue, right? Oh, I start my procedure at 1 and I use this instrument, never cleaned it off, never used it again after I touched it that first time, and it's been 7 hours, and that blood and tissue is nice and dried, hard as a rock on that thing. That's a problem, because when it gets back to SPD, they're going to have to make sure that that instrument gets cleaned, and it makes their job way more difficult, and it's not a best practice. So soil materials need to remain moist. This can be accomplished by using special containers, a pre-treatment product, or towels moistened with water. So why can we use sterile water but not saline on our instruments? What's the limitation with saline? Okay, so I have saline causes rust, corrodes instruments, it's corrosive, it could possibly damage. Yes, okay, all of these are perfect. So, quick tip, when you're okay, my words. I was thinking 3 different things and they were all coming out at once. When you're taking your test and they're talking about cleaning, disinfection, and sterilization, if they have the use of saline as one of their answer choices, specifically relating to surgical instruments, etc., your ears should like prickle up a little bit and be like, wait a minute, why are they talking about saline? Because most of the times you're going to be able to cross those out, right? And say, yeah, no, nice try. You're not going to get me this time because I know that I shouldn't be using saline on those instruments. Cleaning and rinsing is the most important step. It is bolded and underlined because it's not enough to just bold, it's not enough to just underline, and honestly, maybe I should highlight it as well because it's so important. It is the most important step in the reusable medical equipment process. Cleaning reduces the bioburden and removes foreign material, organic residue, and inorganic salts that interferes with the sterilization process by acting as a barrier to the sterilization agent. It really sucks, and I can say this from experience, to be working on a tray, have all of your instruments separated out, and for you to get down to some Adsons, or they look kind of like little tweezers, and to find tissue on them. Because you know what that means? That means the whole tray has got to go back. So cleaning is important. Go spend some time in Decontam. Learn from your decontamination team. Spend time in SPD. There is so much to learn from that department. Decontamination. Reusable items should be transported from the point of use to the reprocessing area in a closable, puncture-resistant, leak-proof containers that are properly marked as biohazard. Standard precautions should always be adhered to when handling contaminated medical equipment. Contaminated items should be transported to a decontamination area where they must be thoroughly cleaned and decontaminated using water with detergents or enzymatic cleaners. Quick polling question. For those of you who are in hospitals, how many of you spray your enzymatic solutions in the OR? And then how many of you spray it when it gets to SPD? So I'm getting a lot of people saying we spray in the OR, we spray in the OR. I do have somebody saying that they spray in SPD. But mostly everybody is saying the operating room. Yeah, and that's also another thing that you need to keep in mind. When are your instruments getting their, and different departments, or not departments, different facilities may be using different things. There's some where there's a gel, there's some where there's a foam, etc. So yeah, but the majority of you are spraying in the OR. Okay. Remember to pre-clean at the point of care. Yeah, and that's something that we're definitely working on, but I really recommend you go spend some time looking at your instruments and seeing what they look like when they arrive to SPD. So instrument cleaning manually. The 2 essential components are friction and fluidics. Using friction, so rubbing, scrubbing the soiled area with a brush, is an old and dependable method, and that is most definitely what we do and what I do when I'm in decontam. Fluidics, which is fluids under pressure. Okay, let me tell you guys about. So when I was first getting trained in decontamination and spending time with SPD, they operate a lot of their equipment with pedals, like foot pedals, like on the ground. And so when I was, they have this like highly pressurized water that you use to flush, all different types of like your lumens, instruments, anything within the sink. But that thing is like so powerful. You have to be really careful that it's not outside of the water, so that it's underneath the water when you're spraying it, because otherwise it can literally go everywhere. So yes, fluids under pressure, fluidics, is used to remove soil and debris from internal channels after brushing, and when the design does not allow the passage of a brush through a channel. And instances when it may not allow the passage of a brush through a channel That's why you have to use that high pressure, because a brush may be too big in order to fit into those really, 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 really tiny channels. I'm trying to remember, I think it's a Fraser suction. Sorry, I'm not as good with my instruments as I should be, but they have these really, really, really tiny, tiny, tiny lumens. Like you can only clean them with, it's almost like a kind of a long needle type of thing. It's not even a brush, but that's one of the reasons why you need to make sure that you're paying attention to how things are being cleaned, whether they're using brushes or that those fluids under pressure. Next is mechanical units. So these are going to be your ultrasonic cleaners or your washer disinfectors. And this is where equipment is going to go, your instruments are going to go once you're done with the actual manual cleaning. When using a washer disinfector, care should be taken as to the method of loading instruments. Also, lids, you have to pay attention. Like, does my lid have a bottom? Because if there's a bottom, what does that mean? What does that mean for my washer disinfector? That means that water isn't going to be able to actually thoroughly clean the equipment. I need to take some pictures now that I'm realizing. So we're gonna come back. We're gonna have to do like a follow-up to this one, because I feel like well, we actually do a follow-up at the end for cleaning, disinfection, and sterilization. I want to really show you guys some pictures for those of you who can't get into an SPD department of what these things look like. And maybe even, you know what, might be bold and make a little YouTube montage or something. I'm a little artistic. I have a little bit of creativity in me. So who knows? I'm writing down ideas just because I want you guys to be able to really see this. I want it to be more than just words on a slide or on a piece of paper. So hinged instruments should be opened fully to allow adequate contact with the detergent solution. The stacking of instruments in washers should be avoided. Instruments should be disassembled as much as possible. Your hinged instruments, everything needs to be open. You need to ensure that all of your stuff, all of your instruments are open so that when they're in the washer disinfector, it can get into all those nooks and crannies and crevices and clean everything out real good. Now, it's important to note that even though we have all of these things in place, instruments can still get to the clean side not thoroughly cleaned. And that's why that manual inspection process when you're getting ready to set up a tray is so important. Next, let's talk about mechanical or automatic cleaners. So ultrasonic cleaning removes soil by a process called cavitation, an implosion in which waves of acoustic energy are propagated in aqueous solutions to disrupt the bonds that hold particulate matter to surfaces. That's like a beautiful sentence. But the way I think about it, it's like all these little bubbles. There's all of these little bubbles just popping while it's in the ultrasonic cleaner and like getting rid of dirt. You know those Dawn soap commercials where they show you like the little bubble where it like scoops up all the dirt and then takes it away? That's what these things do, like in plain terms. But there is beautiful scientific language to thoroughly explain how they do it. But that's what I think about. Those are the little images that come to my head when I think of ultrasonic cleaners. Users of ultrasonic cleaners should be aware that the cleaning fluid could result in endotoxin contamination of surgical instruments that could cause severe inflammatory reactions. Next, your washer decontaminators and disinfectors act like a dishwasher. They are. That uses, well, they're like a dishwasher when you see them through the window. Uses a combination of water circulation and detergents to remove soil. These units sometimes have a cycle that subjects the instruments to a heat process of 93 degrees Celsius for 10 minutes. And this is okay. So the ones that we have, you can actually see through them. So they're this like thick uh glass. Well, I don't know if it's glass, but it's see-through. You can see as the machine is working, all of the washing and the water and everything inside the machine. All right. Washer sterilizers are modified steam sterilizers that clean by filling the chamber with water and detergent through which steam is passed to provide agitation. Instruments are subsequently rinsed and subjected to a short steam sterilization cycle. Another washer sterilizer employs rotating spray arms for a wash cycle, followed by a steam sterilization cycle at 285 degrees Celsius. And then washer pasteurizers expose instruments to hot water for 30 minutes at a temperature of 70 degrees Celsius and are typically used in the reprocessing of respiratory therapy equipment. In the exam, a lot of the times when they're going to talk about your washer pasteurizers, they're going to link it back to respiratory therapy equipment, so you need to remember that. So why is it 70 degrees Celsius? Why is the temperature 70 degrees Celsius for a washer pasteurizer? You can take a guess. Krista, yes, to not damage plastics. Perfect. So it's less than the temperature that typically damages plastics, right? So very good. So 70 degrees Celsius is about 158 degrees Fahrenheit, and some plastics have a melting point as low as 165 degrees Fahrenheit. So yes, absolutely. Critical items. So critical items are objects or instruments that must be free of any microorganisms, including bacterial spores, when they enter sterile tissue, bone, or the vascular system in order not to introduce microorganisms into the site, resulting in an infection or disease. This category includes surgical instruments, cardiac and urinary catheters, implants, and ultrasound probes used in sterile body cavities. The items in this category should be purchased as sterile or be steam sterilized prior to use. Steam sterilization under pressure is one of the oldest and most effective methods for sterilization and is the preferred method for the sterilization of critical medical equipment. This last bullet point is very important. Steam sterilization is going to be our preferred method. However, we have all different sorts of instruments and equipment that cannot handle steam sterilization. They are heat sensitive. And so you have to have other methods to achieve sterilization. And that is what they're going to ask you a lot of questions about on the test, is your different sterilization processes. They can get into specifics about temperatures when it comes to sterilization. If you're good with numbers, if that's something that is very easy for you to remember, those questions will be very easy. Those were a bit challenging for me because if you're not doing this all the time, if that's not, if you're not working in SPD all the time, it can be really easy to forget what temperature goes with each type of sterilization. So critical item. If the item is heat sensitive and cannot be steam sterilized, the object may be sterilized with ethylene oxide, hydrogen peroxide gas plasma, ozone vaporized hydrogen peroxide, or liquid chemical sterilants. So liquid chemical sterilants. With the exception of 0.2% peracetic acid, 12 minutes at 50 to 56 degrees Celsius, have indicated exposure times that range from 3 to 12 hours. So for our liquid chemical sterilants, we're looking at an exposure time of 3 to 12 hours, except for peracetic acid. So that's a pretty long time. That's a pretty long time for a liquid chemical sterilant. Another thing that you need to know for liquid chemical sterilants are going to be some of your limitations. And that's what they're going to ask you on the test. What are your limitations with liquid chemical sterilants? The use of liquid chemical sterilants is that another limitation to the use of liquid chemical sterilants is that the device cannot be wrapped during processing, creating a challenge for maintaining sterility after processing and during storage. Devices require rinsing following processing with liquid chemical sterilants. The type of water, either sterile or filtered, should be determined by the manufacturer's instructions for use with both the device and the liquid chemical being used. Due to the inherent limitations of using liquid chemical sterilants for sterilization, their use should be restricted to reprocessing critical devices that are heat sensitive and incompatible with other sterilization methods. So, key takeaway here is you only want to use liquid chemical sterilants if it is absolutely necessary and you cannot use any other type of method, because there are so many limitations to ensuring sterility, and that's the real problem. It's difficult to ensure sterility when you are dealing with liquid chemical sterilants. Next, let's talk about semicritical items. So semicritical items are those that come in contact with mucous membranes or non-intact skin. This category includes respiratory therapy and anesthesia equipment, gastrointestinal endoscopes, bronchoscopes, laryngoscopes, esophageal manometry probes, anorectal manometry catheters, endocavitary probes, and those are going to be your rectal and vaginal probes, prostate biopsy probes, infrared coagulation devices, and diaphragm fitting rings. Semicritical items are my favorite. They really are. Semicritical items give you the most headaches out of the three criteria. And there's going to be so much research that's going to come out over the next few years on these types of devices, because this is the highest category where we find issues and problems in, by far. You need to know your devices and their classifications, and you need to know that if you have a semi-critical item, that it needs to undergo high-level disinfection. So these are some really good examples, but one suggestion that I have for you is to go ahead and write some of these down, some examples of non-critical, semi-critical, and critical, and put them on flashcards, and make sure you know where those items, what type of class, Spalding classification those items belong to. Because it's going to be on the test. It's going to be on the test. It will be on the test, and hopefully you will remember this. Either you'll see the slide, or you'll think about the chapters that you have read, or you'll hear my voice, or one of these things. Whatever helps you remember and pass this exam, I'm happy. Also, you should most definitely know the places in your facility where you have semi-critical items. These medical devices should be free of all microorganisms, so mycobacteria, fungi, viruses, and bacteria, although small numbers of bacterial spores may be present. Intact mucous membranes, such as those of the lungs or the gastrointestinal tract, generally are resistant to infection by common bacterial spores, but are susceptible to other organisms such as bacteria, mycobacteria, and viruses. Semi-critical items minimally require high-level disinfection using chemical disinfectants. These are going to be some examples: glutaraldehyde, hydrogen peroxide, OPA, improved hydrogen peroxide, peracetic acid with hydrogen peroxide, and chlorine-based products are cleared by the U.S. Food and Drug Administration and are dependable high-level disinfectants provided the correct parameters for time and temperatures. Okay, let me see if I can pull up this chart really quick, because this will be on the test. Okay. So one recommendation that I have is, hopefully you can see this chart. Let me see. Yes, it's a bit small, but on your APIC text, you're going to have this table 31.2, summary of advantages and disadvantages of chemical agents used as chemical sterilants or as high-level disinfectants. So with OPA, one of the examples that I see used a lot is they'll reference anaphylactic reactions to OPA in bladder cancer patients with repeated exposure to OPA through cystoscopy. That's one of the examples that they use a lot. But you can see that the disadvantages for these types of sterilization methods are pretty lengthy. Like there's quite a few bullet points for a lot of these. And this chart is important. You need to know peracetic acid, hydrogen peroxide. What are my advantages? What are my disadvantages? Some are more expensive than others. Some cause irritation. Hydrogen peroxide, you can have serious eye damage with contact. Material compatibility, so brass, zinc, copper, and nickel, so silver plating, both cosmetic and functional. You need to know your advantages and disadvantages. So I really highly recommend that you look through this chart and that you create some flashcards and get it together. So, yes. Audits of reprocessing of semi-critical devices. Staff should receive competency training and evaluation on the safe use and reprocessing of the equipment. Infection prevention rounds or audits should be conducted at least annually in all clinical areas that reprocess critical and semi-critical devices to ensure adherence to the reprocessing standards and policies. Results of infection prevention rounds should be provided to the unit managers. Deficiencies in reprocessing should be corrected, and the corrective measures should be documented to infection prevention within a few days after rounding based on facility policy and procedure. Basically, what they're trying to say, because obviously this is all from the APIC text, is you should be out there, you should be observing, you should be involved. And I know it's difficult. There is already so much on every IP's plate, especially in the middle of a pandemic. But some of the things that I have found when you do an audit is that staff can a lot of the times verbalize exactly what they're supposed to do. Like they know what they're supposed to do. They know exactly what they're supposed to do. But then when you sit down and you actually observe, when you conduct the audit and you ask them to reprocess something, or, a lot of the times when I'm doing audits, I will obviously introduce myself to the patient and say, I'm with the infection prevention department. This is one of the things that our hospital does in order to ensure your safety and the safety of all of our patients. Is it okay for me to observe your visit? And the person can say yes, or the person can say no. But that's also another opportunity for you to really see what happens in those rooms and what happens after the patient leaves, how they take care of those devices. Highly recommended, because APIC is recommending it, but it's the right thing to do. Local versus central reprocessing area. Central processing areas offer several advantages to include validated and specialized reprocessing equipment and persons that specialize in instrument reprocessing. Local reprocessing offers the advantage of faster instrument turnaround, less instrument loss, and lower instrument inventory. In one study, instruments reprocessed by the central decontamination unit had significantly less residual protein than instruments reprocessed by the local decontamination unit. Periodic inspection for quality and infection prevention purposes are recommended for all areas where equipment is reprocessed. And this is essentially about where central reprocessing in your sterile processing department is housed. Do you have a central department where everything that needs to be sterilized is coming over to them? Or do you have a local approach where it's being done at that specific, in that specific department, in that specific outpatient surgery center, etc.? From the APIC text, their recommendation is most definitely central processing. You want to have a central processing area because that's where you're going to have your most highly skilled, most highly trained, access to better equipment in that central processing area. I can tell you from my time at the health department that there are some really questionable practices happening in reprocessing departments that are outside of hospitals. And even within hospitals, there are also some really questionable things. So paying attention, being involved, and having relationships with this this department is extremely important. And Mona says it's kind of scary. It is. It is frightening. It is frightening because you have to think about the frequency in which some of these outpatient sites are getting visits, right? Think about how often an infection preventionist is going out to outpatient sites to look at their process, to look at what their departments look like, the things that they're doing. I mean, I obviously can't talk about any specifics, but if you are responsible for outpatient areas, you really need to ensure that you're putting them on your radar, because those are the those are the types of places that end up on the news, right? You need to make sure you're getting out to your designated areas, um, because you don't want the health department to be the people coming in and asking you, wait, what? You're doing this here? Absolutely not. I mean, I've had to do that before, where it's like, no, you can no longer reprocess here, effective immediately, right? And as the health department, you're not regulatory, but you can give very strong recommendations. And if a facility is not willing to comply, you can get ACA involvement. You know, your processes are not up to standards and you're putting patients at risk. Therefore, we need to red flag, right? It's a there's no yellow card. It's like it's a red card. Come on, we got to stop. So, not trying to scare anybody. I'm just letting you know that this is important and you need to get out there and you need to see what you're responsible for and ensure that things are getting done. So biofilms are like one of my favorite things. Biofilms are, they're terrifying, they're fantastic. It's one of the most, I think, exciting aspects of the future of infection prevention, just the things that we're going to continue to learn about how biofilms and water water management programs, sinks, drains, showers, the type of role that they play in the spread of infection, like it's just fantastic. So biofilms are microbial masses attached to surfaces that are immersed in liquids. Once these masses are formed, microbes may be resistant to the disinfectants by multiple mechanisms, including higher resistance of older biofilms, genotypic variation of the bacteria, microbial production of neutralizing enzymes, and physiologic gradients within the biofilm. Bacteria within biofilms are up to 1,000 times more resistant to antimicrobials than the same bacteria in suspension. So you have these like just I don't even know like mutant ninja turtles type of bacteria that are within biofilms in the sink drains, and you guys need to learn about this. Okay, I can't even explain everything to you, but you need to listen to Amy Mathers, Dr. Tara Palmer with the NIH. You have to go out and seek this information because it's absolutely fascinating. Biofilms have been found in whirlpools, dental unit water lines, and numerous medical devices, contact lenses, pacemakers, hemodialysis systems, urinary catheters, central venous catheters, endoscopes. So biofilms are in places where you don't even know that they're there, right? But they're there. They're there. So that's why you're cleaning, that point of use cleaning, ensuring that you're not getting those instruments caked on and any type of biofilm forming on them is really important. So this is Dr. Tara Palmer's lecture on multi-drug resistant organisms in hospital drains. It's one of my favorite, absolute favorite lectures. So one place you can watch it on is on my YouTube channel, CIC Epidemiologist, or you can also find it in one of our links in the Excel file. So you have multiple methods of learning more about her. One of my goals is to have Dr. Amy Mathers, who's one of the key, I mean, she's amazing, but she works with the Sync Lab at the University of Virginia, is for her to like come on this group and talk about biofilm, because that would be just the most fantastic day ever. I'm a big fan, huge fan. It would be fantastic. So there's a lot of really great resources. You need to know about biofilm. Honestly, we should just have a whole lecture on biofilm because it's just so fun. So here's your biofilm growth. You have your colonizer, your single little free floating bacteria that starts it all, that starts the process, the snowball situation, the partying in the drains. So here it is, single free floating bacteria on the surface. Bacterial cells then aggregate and attach. Then you have growth and division of bacteria for biofilm formation. Then you have mature biofilm. And then number 5, part of the biofilm disperses to release free-floating bacteria for further colonization, which means you have these little blobs of bacteria making their way down the piping system and finding another little home to start creating their own massive empire of biofilm. And then guess what they do? They just party it up in the pipes. They party it up in the drains. And guess what we do? We do nothing but feed them. Think about juices, Coca-Cola, dextrose. Think about the things that you are putting down that drain, and you're just making them stronger, feeding them. So, okay, sorry, I'm getting a little passionate about biofilm because it's just so fantastic. But let me calm down. So, toxic anterior segment syndrome, TASS. Is it TASS or is it TASS? Can I say either? Does anybody know? I'm not sure. I'm not getting any answers. Okay, so toxic anterior segment syndrome is an acute infectious inflammatory reaction of the anterior chamber of segment of the eye that typically occurs 12 to 48 hours after an uneventful cataract surgery. Common symptoms include blurry vision, redness of the eye, ocular pain, corneal edema, and severe inflammation that is limited to the anterior segment. Symptoms often mimic those of infectious bacterial endophthalmitis. However, TAS symptoms improve after the administration of topical or oral steroids. And we did cover this, and I think, is it chapter 68? I think we covered this in chapter 68 recently, where we kind of touched on this a little bit, specifically relating to our ophthalmoscopes. Ophthalmoscopes. Spalding classification of ophthalmoscopes. What is it? What is the classification of ophthalmoscopes? Is it critical, semi-critical, or non-critical? Okay, everyone's saying semi. Good. Good, good, good. I'm actually getting some engagement. Last time I asked this question, I was getting all sorts of answers, so I'm glad I'm seeing semi-critical. Surgery and TAS, a variety of substances that can enter the eye during or after surgery, as well as breaches in sterilization and disinfection of intraocular surgical instruments have been implicated as causes of toxic anterior segment syndrome. These substances include detergent residues, topical ophthalmic ointments and salt solutions, antiseptic agents, talc from gloves, water bath contaminants, impurities of autoclave steam, heat-stable endotoxins, and irritants on the surface of intraocular surgical instruments. Early identification of TASS for single cases as well as outbreaks requires the implementation of a surveillance systems involving surgical staff, infection prevention, and cleaning and sterilization personnel. So human papillomavirus, HPV. Human papillomavirus is an extremely common sexually acquired infection and is considered the cause of cervical cancer, with approximately 70% of cervical cancers being attributed to 2 types, HPV 16 and HPV 18. A recent study showed that a considerable number of endovaginal ultrasound probes were contaminated with HPV, 28% pre-examination. That means 28% of the vaginal probes had human papillomavirus on them before being used. That's for anybody who what does the 28% pre-examination mean? That's exactly what that means. Endovaginal ultrasound probes are semicritical items even if covered with a sheath or probe cover, and require high-level disinfection. HPV contamination of endovaginal probes can occur regardless of sheath or probe cover usage. So let me tell you what I did after I found out this really fantastic information. I'm a lady, right? I have a lady doctor. I called and I asked the office, do you guys have a trophon? What type, what are you using for your high level disinfection of your probes? Because I could not continue my life without knowing what type of equipment the office was using. They were not using a trophon, needless to say. I have another lady doctor now. But this is important, right? You need to know how your high level disinfection is happening on your facilities. And then for those of you who have no idea what I'm talking about, we use trophons. Trophon, let me pull up a trophon. How many of you guys use trophons in your facilities? Okay, Krista's saying we do. All right, so this is what it looks like. That picture's not that big, but okay. So here's your trophon machine, which does your high level disinfection of your probes. And you can see that she's placing the probe in there. You lock that thing up. Obviously, there is pre-cleaning that needs to happen before you put it into the trophon. It can't just be like, here we go. But this is what it looks like. And this is what we use. So yes, important. Remember, your vaginal probes are going to be semi-critical devices, which means they require high-level disinfection. All right, inactivation of Creutzfeldt-Jakob disease, or CJD, which is CJD is what? What is it? Starts with a P. Yes, very good. Since the CJD agent is not readily inactivated by conventional disinfection and sterilization procedures, and because of the invariably fatal outcome of CJD, the procedures for disinfection and sterilization of the CJD prion have been conservative and controversial for many years. On the basis of scientific data, only critical surgical instruments and semi-critical devices contaminated with high-risk tissue. And okay, this little parentheses here, brain, spinal cord, and eye tissue, important to know. High-risk tissue. The way they can pose the question to you is what would be considered high-risk tissue for Creutzfeldt-Jakob disease? This is where you're going to think about brain, spinal cord, and eye tissue. I know it's in parentheses, and you're like, oh, okay, it's in parentheses. It's an important parentheses to pay attention to. From high-risk patients, so known or suspected infection with CJD or other prion disease requires special prion reprocessing. A moist environment post-contamination reduces the attachment of both protein and prion amyloid to the stainless steel surface, so maintaining moist conditions at the point of use is critical. Okay, so inactivation of Creutzfeldt-Jakob disease. After the device is clean, it should be sterilized by either steam sterilization or using a combination of sodium hydroxide and autoclaving using one of the following options. So you have 4 different options of things that you can use. If you're good at remembering numbers and time frames, great. But I can tell you, it would be very difficult for me to remember this. A lot of infection prevention, what it is knowing where to find answers to your questions, right? So knowing, hey, oh yeah, I know I can find that in CDC guidelines that were published in 2007, updated in 2019. I know I can find this in CDC environmental chapter. Oh, this was mentioned in the APIC text. I know exactly where to go. That's how a lot of issues and problems are solved within infection prevention. So when you get an email asking you about pharmacy and, hey, I have filamentous fungi growing in pharmacy, what am I going to do? When you get that phone call, what are you going to do? you should know, okay, well, these are my resources. This is where I can go and this is what I can find. And I think that for this test, they want you to have an understanding of infection prevention and for you to feel comfortable with a lot of the big major topics of our field. So if you struggle with remembering specifics like temperatures, try your best, but not all questions are going to be, you know, expecting for you to have things like this memorized, like, oh, I need to steam sterilize at 134 degrees Celsius for 18 minutes. Because yes, you may remember that for the test, but you might forget it right after, right? And then reprocessing of endoscopes. So the reprocessing of endoscopes is a whole situation where we don't have enough time to cover it because we're at the end. I wanted to give you guys some time for questions. Does anybody have any questions? We are halfway through the group. We're halfway through. That means you should be signing up for your test like within the next 2 weeks if you're planning on finishing it out with us. The only thing that's really going to push you to take your exam is to sign up. Right? You have to make that commitment. You can continue to come and listen and review and read, but until you really, after you really commit and sign up for a date, that's when it gets real. That's when the pressure is on and you feel like, oh, okay, I have to get serious. Like it's happening. So one of our international friends said that the Dubai Center is fully booked. Dang. That's bananas. It's fully booked. Yeah. We have a question. Has anyone tried the Pro Proctor exam? Is there any feedback? I don't know if we have anybody on who's recently taken it, so I don't know if we have any feedback. Okay, I'm not getting any more questions at this moment in time, so I will see you guys next Friday. Make sure you do your readings. Next week, let me pull up next week. Next week, we're starting employee and occupational health, but we're halfway through. So it's a lot of chapters. It's a lot of chapters. I need to break this up for future people because this is a lot of pages. So yeah, we're starting employee and occupational health next week. Thank you guys, and I will see you next Friday.